All righty. Yay. And everything is still good on interpreter side of things. Awesome.
Awesome. Well, welcome to Transition Talks Tuesday. My name is Tim Markle. I'm director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. With me tonight is Liz Kennedy from Sauk Prairie School District. We are presenting Transition Talks in combination with Sauk Prairie School District, and we are very grateful to Interpreters Co-op of Madison for providing our Spanish language interpretation, which is also being supported by the Wisconsin Integrated Transition Planning Project. You'll notice I have a handsome young man to my right this evening.
Hello, everyone.
We are going to be talking to you about healthcare transition. So what we like to call the part that people are like, what? That changes too, but everything else in my life is changing. Yes, healthcare is going to change too. So give me one moment and we're going to share our screen and get right into it. Just give me one moment to get my screen situated. All right, and hopefully everything looks good. Awesome. So why don't you go ahead and introduce yourself, dude?
All right. As he says, I am his handsome young son. My name is Hunter Markle. I am 25 years old, and I am on the autism spectrum.
Awesome. My name's Tim Markle. I'm Hunter's dad. I also work with the Youth Health Transition Initiative of Wisconsin, as well as the Southern Regional Center. So just to give you a little background about the Southern Regional Center, we're one of 5 regional centers throughout Wisconsin, but we also have a group of people, some hubs of expertise, some people that specialize in medical home, who specialize in family engagement, and they assist the regional centers in helping to put on workshops for families. And so we work together as a unit to try to make the system a little bit better. As I said, we have 5 regional centers. So wherever you are in Wisconsin, you are close to a regional center.
I still feel like we should just do 4 and get rid of the one centered around Milwaukee.
There's 8, but dude, most people that live in Milwaukee, there's more people living in Milwaukee than pretty much the entire state. I mean, we have a population center there, so we can't get rid of them.
No, I mean just the regional center and combine the 2 southern ones into one.
Oh, no. They're so big. They need their own. Matter of fact, you could get rid of the other 7 counties and just have Milwaukee, and you'd still be plenty busy.
True.
Yeah. But we're not in Milwaukee.
No, sadly.
We are in the southern, I like the southern region.
Oh, I love it too.
We're in the southern region, and so those are the 14 counties that we cover.
But you can't deny Milwaukee has a beautiful view.
Milwaukee is gorgeous, has a gorgeous lake. I love visiting Milwaukee. I do.
Yeah.
And we're going there.
Yes, we are later in October.
So the Youth Health Transition, we do a few things around Wisconsin. Number one, we offer support for healthcare providers and organizations. We believe, sorry, Julio, I will slow down. We believe that healthcare transition should live with the medical centers, and that these medical places, whether it's a medical clinic or a system or just a single doctor, should be aware of when their pediatric patients, when their adolescents are turning into adults at 18, and what transitions are going to occur medically wise, and help their patients prepare for that. So we work on workshops for the medical providers. We also have a website, and we do these workshops in the community. We also make sure that as new information comes out on healthcare transition, we send that out in a quarterly newsletter. And most of all, we believe that healthcare transition should not be standing alone. That is very important to the success in education, employment, independent living, that pretty much healthcare and health are foundational to success. So you want to tell them where we're going tonight?
We are going to be talking about healthcare transition, what healthcare skills can be learned and practiced before adulthood and possibly even during adulthood, as We are still
Absolutely.
learning because we're human. We love learning. And how does healthcare transition impact all other areas of transition? And this will be useful for both young adults on the spectrum and off the spectrum.
Absolutely.
We do not discriminate based on that.
We do not. So, dude, do you remember this picture? It's been a while.
Yes, I do. The only thing I don't remember is that green pole.
Oh yeah, no, it's out there, maybe covered under water.
Most
right now,
likely it's
but-
underwater by now, yeah.
So why do we use this picture when we talk about transition?
Because it's a good stepping stone story, much like healthcare transition is a stepping stone.
Do you want to tell the stepping stone story, or do you want me to?
You can for once tonight.
Okay, well, this is a picture of Hunter and me out at Door County, and this is out on a pier, and you had to step over a little bit of water to be able to get to the rock. Water isn't exactly your favorite thing in the world.
No.
So
But weirdly
said,
enough,
hey,
I am not hydrophobic. I
You're
just don't
not.
like water.
but I said, hey, let's go out to that rock. And you said, no, absolutely not. So we really thought it would be a cool picture, and it'd be cool that he'd enjoy it once he got out there. You're going to, just like adulthood, you're going to do okay in adulthood, but it's scary to look forward to it. So we took our time. We walked around the pier. We had your sister and nieces went out on the rock.
Cousins, not nieces.
Sorry, cousins out on the rock.
I'm not old enough to have nieces yet.
Well, you are, but thank goodness you don't. It's fine.
True.
It's fine. So then we had other people try it out, and then I went out and I helped you across, and it was this process that got you out there. How did you feel once you were able to get out onto that rock?
Happy but scared.
So yeah, just like transitioning into adulthood. It's a great place to be, but it's still kind of scary.
Everything is scary. It's October.
And everything's a process.
Yes.
And so we want to talk a little bit about that process.
100%.
So do you want to talk about what healthcare transition is?
It is the process of going from pediatric care to an adult care method of healthcare and everything within the American health system.
Correct. And so that could be either from moving from a pediatrician to an adult care doctor, or it could be a family care doctor, a family doctor, who you're just sort of moving systems, that there could be differences in the way they see and make appointments for and work with their pediatric patients, their young adults and their children, versus when that person is an adult. And the hospitals can change too.
Right. It could also be a change from a pediatrics specialist because this child has such and such healthcare problems, and they are now transitioning into adulthood. It means that their specialist also might change.
Absolutely. Absolutely. So what I want you to imagine when we talk about healthcare transition is I want you to think about it in three different parts. Number one, the part of preparing for transition. So all sorts of things that we have leading up to that transition time. And then what happens is we have a transfer of care. When a new doctor is actually in charge of that healthcare team with the patient. And so we have that transfer. And then the goal of all of this is so that young adult who built up the process, has a transfer of care, becomes fully integrated into the adult care system for the rest of their life.
Yep.
Where would you say you are in that process?
Semi into fully integrated.
Yes, exactly. You have worked at preparing for it. You've had the transfer of care, but there's still some things that we're working on.
Yep. Paperwork.
Excellent. So as I
Lots of paper.
as I mentioned before, we do work with clinics, and one of our national organizations that we work with is an organization called Got Transition, and they put out guidelines for doctors, guidelines for medical professionals to help them guide their families in transition. And so I just included,
well, as best as they can.
As best as they can. So we included what they call their transition timeline that they give providers, clinics, and systems, because again, this is where we want healthcare transition to live. So who needs to think about transition?
Adolescents, young adults, families, schools, employers, community, the government, everyone.
Why do you think I
Safe
put
for
in there?
babies. Babies don't need to worry about it yet
Oh,
because
but
they
we
don't.
want families to think
No,
transition from birth.
babies.
Oh, the babies themselves
Yeah, the
don't.
babies
Okay.
themselves.
Babies themselves don't. You're right.
Yeah, no. But
You're
the
right.
families who have the babies, yes.
Cool. So why do you think it's important if when I write there that especially if someone is identified with a disability or healthcare need, why do you think that matters to them?
Because some people with disabilities don't fully interact with the world as neurotypical people see the world.
Yeah, their interactions usually come a little bit later.
Right. Or way too soon, and they just are immediately understanding way too much as a 13 or 14-year-old when it
That could happen on that side
Right,
too.
exactly.
You're absolutely right. What I see a lot with the parents is that we do such a good job of taking care of our children, we forget that we're supposed to be teaching them how to become more and more independent.
Right.
And so they begin sometimes interacting with their own doctors a little bit later than the neurotypical kids. The other thing is, I know, I'll talk about me instead of you. I know I don't get everything the first time. Do you understand?
Yeah.
There's some things you understand the first time,
Correct.
but are there other things that maybe take a little while more to understand?
100%.
And so that repetition could be important. So you start earlier so you can repeat the steps and the important stuff.
Right.
Cool. And also then with healthcare is some of our friends, that continuity of care is so important that they can't have that gap in coverage. It could be very detrimental to their health. And so it's really important. So what we want to talk about today is we want to focus in on the preparing for transition. And we're going to talk about some tools that have been developed that we think are important into helping families, helping young adults transition. So let's start with the providers, hospital, and procedures. So
Right.
you now have an adult doctor.
Yes, I do. I have at least 3 on my healthcare team.
Excellent. And how did you find your doctor? You used to have a pediatrician.
Right.
How did you not have a pediatrician?
Through your help and changing of hospitals.
Okay.
From, again, a pediatric style of hospital to a more general hospital and everything.
Mm-hmm. Yeah, you went you're right, you went from the children's hospital to the adult hospital. And do you remember how we transferred that care? Do you remember the conversation we had with
more of a conversation between the pediatrician asking why and me asking why, because the current pediatrician we had was a close family friend, or at least a family friend.
Mm-hmm. Yeah, and so we had the discussion. We asked him to spend some time alone with Hunter, and he said why, and we asked Hunter to spend time alone with the doctor, because it was really important to me that Hunter learned that that's his healthcare, that's his doctor, and that he has every right to talk to them about stuff that even he doesn't want to talk to his parents about. I know. What could that be? Shocking. Shocking. And so when that didn't go so well, I decided to talk to my primary care doctor about Hunter, and I introduced Hunter to my primary care doctor, and you guys hit it off.
Yep, hit it off like 2 peas in a pod or a missing puzzle piece.
So what do you like about your primary care doctor?
They dumb down everything.
They make it easy for you to understand.
Yep.
Cool. What else? Anything else that you like about them?
They're easygoing. They laugh at my jokes 90% of the time. And
that's more than I laugh at your jokes.
Yeah, you laugh 70%. Mom is more like 72, 73, depending on the day.
She's a good person.
Yeah, she's an amazing person.
Anything else about your healthcare team?
More, again, just the whole dumbing down of everything, and they try and keep me centered.
Excellent.
And grounded in the appointment, so I don't go rambling off on random things.
So they keep you focused on your health.
Yes.
Awesome. So yeah, I love the fact that you like your doctor and your team, and we're both going to be sad when he retires.
Yeah.
But we'll find someone
they
else.
They are getting close to that age, aren't they?
Yeah, they are. Yeah, absolutely.
Even though they don't look it.
So there are some, you already mentioned that besides that primary care doctor, there's also specialists that sometimes just specialize in like pediatric diabetes And so then you want to find an adult diabetes who understands what's going on with the adult body.
Yep.
Sometimes the hospitals can change. And I know we have some friends who that routine, knowing where they're going to go, is really important. And so
100%.
And so if we have a child who is that is a lot more comfortable when they're able to preview where they're going, to understand when are they going to go to that different emergency room, when are they going to go to that different hospital, to maybe foreshadow it, to maybe do a social story, to take a visit before they have to go there in the middle of an emergency.
That would be 100% useful for a lot of kids and their families.
Absolutely. And as I mentioned before, sometimes it's just the procedures that change. As you see, you can continue to see the same doctor, but sometimes the appointments aren't as cohesive.
Yeah.
I know that we have some kiddos, some friends in the area of diabetes that when in endocrinology, when they're in the youth system, they are able to see their nurse educator, they get their blood drawn, they see the doctor, they get everything done at that one visit. And then sometimes, depending on the system in the adult world, they're not even sure which person they're going to see. And so that appointment sometimes gets separated out, and they have to make these separate appointments, or they have to have their blood drawn beforehand. And so it can change depending on the disability. And so it's just really important to figure out what's going to be different when he's going to the adult healthcare.
100%.
And then the final thing that we'll move on is the fact that, remember too, at 18, legally things change.
Yeah, legal wise, you are an adult. In the eyes of the law and of the government, you are an adult.
Yeah. If nothing changes when you become adult, no action is taken, you are then legally responsible, which makes you legally responsible for all your healthcare.
Yeah.
And what that means is that then the healthcare system, if nothing has changed there, you're the only person they want to talk to.
Right.
Is because they believe a lot in privacy.
Yep.
And so all of a sudden, some of the parents are like, oh, I can't even make an appointment. I can't even. And so you need to look at release of informations and different ways that you can continue to be a part of the healthcare if the adult wants you to remain part of that healthcare decision.
Yep.
Okay.
Another thing is that whole dirty mess of power of attorney.
Yes. And we'll talk briefly about that. We have a whole, matter of fact, just last week we had Tammy Jackson in to talk about supported decision making. So there's a whole recording that you can talk on that. So we're not going to get too much into it. So the question is there
careful with it?
Yes. And being very mindful of people's rights.
Yep.
So Liz asks if there's a referral process or network for families to access when they're trying to transition to the adult system. It depends on the system. The short answer is no. So what we do is we encourage families to talk to their current doctor about who that current doctor would recommend. Talk about, are there specialists in that network that they can move to? Talk to other families that maybe have children with similar disabilities and what they've found. And then what we end up talking to a lot of parents about is that sometimes it's hard to find even primary care doctors who are comfortable with people with disabilities. And it's a problem in the system. Is we're doing better at having our doctors with our kids and adolescents. They're preparing them better, but we still don't have enough doctors that are comfortable in the adult system. And so what I tell parents is, yeah, I know it sometimes feels like there is that you're looking for a unicorn, and you're not always going to find a unicorn. So I recommend you at least try to find a horse that wants to learn. So if you could find that doctor who's willing to go on the journey and learn with you about the disability, willing to talk to those specialists, and is open to that possibility, that's fantastic. And so you may have to, depending on your ability to search for doctors, you may have to interview some doctors. So the system is not great in that aspect yet.
No, because we are human and we build systems for humans. not about humans.
True. And sometimes we don't even build them with humans.
No, we don't.
Wait, that's a problem.
Very much so.
So we already talked about decision making and information sharing a little bit. Again, if you go to the Transition Talks Tuesday Sauk Prairie page, you can watch that recording. So let's talk a little bit more about information sharings. Some of the things that we also encourage during that process is that a lot of times the parent is going to be the primary person who's making those appointments and who takes care of anything that happens outside of the normal doctor's experience. So like if something happens at 2 a.m., the child's probably going to go to the mom or dad and say, oh, what am I supposed to do? Well, we want them to learn what to do about that 800 number on the back of your card.
Yeah.
About where to go in case your doctor's office is closed.
Yep. For the on-call nurse.
Right.
And if it's a serious emergency, 911 is also written on the back of there. I'm pretty certain.
Mm-hmm. So knowing what to do in case those emergencies, as well as knowing how to make your own appointments.
Yep.
Now, do you make your own appointments now?
100% do, through the gloriousness of my chart.
What? You don't pick up the phone?
No.
Man, you're such a millennial.
I'm not even a millennial. I don't know what generation I'm a part of because I was born in 97.
So how did you learn to make your appointments through my chart?
Trial and error.
Yeah, it wasn't exactly the easiest thing, was it?
Still not the easiest, but it's still better than trying to memorize all the numbers for the specific hospitals.
Okay. And so then the other thing we mentioned will change is electronic records. And also the other skill that we encourage families and pediatricians to build in their young adults is the ability to fill a prescription and to understand what happens when the pill bottle gets empty. Growing up, I swear I never had an empty pill bottle. And so I go away to college, medicine runs out. I've never had medicine run out. It's never been empty.
Yeah, it's called having a good mother.
Yeah. And so trying to teach them that there's no magic, is things you have to do things to be able to fill that prescription, as well as learning how to take, you learned how to take vitamins and different medicines, different vitamins, not necessarily medicines.
No,
but vitamins are really important to you.
Yep.
What was the process that you're pretty much on your own?
Yep.
How did you get there though? You didn't just
start. It started out with a 2-week pill container, pill organizer. There we go. That's what they're called, and everything. And having either you or mom refill it. Usually mom, because mothers are amazing at that. Then it switched to me refilling it, and then I started taking the recommended amount from the bottles, because I usually doing these, I usually say, oh yeah, I just straight up take them out of the bottle. Yeah. So you that sounds a negative. That's a very negative connotation. You take them according to the bottle. Yes. Okay. And the doctor's recommendation on the amount. Yeah, that's right. That's right, because sometimes they are recommending a higher amount than what the bottle says for you. Yep. So you follow the doctor's orders. Yep. Always listen to doctors. They know best. And so that's a really good example of a process in building up your skills. Yep. Nice job. Brick by brick. Nice job. Health insurance. We're in the midst of useful, necessary. 100% in life. So there's a difference between private health insurance through an employer or through an individual, and then the public health insurance. We have a public, right? We have private. Oh. So we have the private insurance. It's through my employer. Oh, yeah. So the public would be Medicare or Medicaid, which you might have through Katie Beckett, or that was able to get a children's long-term support waiver. The important thing, one that's public now. Well, the important thing to remember is if there's any public insurance, is those changes, you're going to want to contact the Aging and Disability Resource Center to figure out what's the paperwork you need to be able to continue that insurance after age 18. We also have a recording of the Aging Disability Resource Center of Sauk County that you can listen to learn how to utilize them the best. Now, you really like working with Sauk County, don't you? They're helping sponsoring this right now. So they're my favorites.
for this Transition Talks Tuesdays. I'll have a new favorite in the spring. But
Sorry, Liz.
but we also know that now all people can stay on their family's insurance until they're 26.
Woohoo! Wait,
So-
no, bad. Because I turn 26 come December. I'm 1 month away.
Yes. And so we've been
Ish.
getting a lot of notices, a lot of, we've been getting paperwork. But what I've done is I have asked my health insurance company to look at Hunter's medical record and say, you know what? We consider him to be disabled. Please allow him to remain on my health insurance. We're waiting to hear back from them right now. So we'll see. And if not, then we'll be going to the marketplace. We'll be going to Medicaid and we'll be trying to get you covered with insurance because you'll no longer be able to be covered on mine.
Yay. Paperwork, more paperwork, and paperwork.
So it's just one of those things that you just want to be aware of and plan for before it goes past 18. Some other skills we like to talk about is that whole helping our children make decisions, understanding their own healthcare needs, being able to
Very
talk
key.
about when you don't feel good.
Very, very key.
Checking into appointments. That's a great first step to try and help someone take charge of their own healthcare, is having them go up and check into the appointments, because darn it all, you pretty much know exactly the questions that they're going to ask. So you can prep them in advance to be able to learn that stuff.
Please do prep them. I learned that the hard way when doing phone calls to set appointments. It was usually this guy who set up all my appointments, claiming to be me over the phone, until they convinced me to actually say my name, birth date, and zip code.
There you go. So those are some of the pieces of information that you needed to know.
Yep.
Good job. And then that time alone with the doctor, again, we can't stress enough that we want in the teenage years that the teenagers begin to spend at least a little bit and then growing amounts of time alone with the doctor, so they can talk privately with them, but also so that they can
maybe start like with 5 minutes alone with the
Sure.
doctor, then next appointment do like 10 minutes, 2 appointments later do 15, just slowly build that up until the teenager is able to be in the room for a good half hour, 45 minutes with the doctor alone, and then just do a basic summary if you have a release of information and everything, to ask the doctor, okay, so what are the basics that you and the child and my teenager talked about and everything.
So how many of your appointments do I go to now, Mr. 25-year-old?
0. But does he
Zero.
ask about them? Yes.
All the time, is we still communicate about it. But I think it's really important that you understand that that's your doctor, your healthcare. Even when we would go to appointments with you, both your mom and me were really big on, we wanted the doctor to ask you the questions.
And most of the time he generalized, my pediatrician generalized the questions, and all 3 of us would give different answers to the same question.
Well, sometimes, because
Usually it was them answering the question and I would just go, yeah.
Well, a lot of times they'd ask you a question, you just look at us.
Yep.
Like, how are you doing, Hunter? And you look at us and we'll be like, Hunter, you should know how you're doing. And so we want,
as a child, I did not know what I was doing.
But we want you comfortable sharing that with the doctor, and that's only going to come through practice.
Yep.
So again, that practice with the doctor.
Practice is key, especially when it comes to also emergency contacts.
Yep. Where are your emergency contacts?
Phone, and I'm soon going to get a little slip of paper in my wallet to have your cell phone number, mom's cell phone number, and grandma and grandpa's house phone, because they still have a house phone.
They do.
It's amazing.
So to sort of sum up before we go to the next step is, we encourage everyone to stay a step ahead. Take a look at the goal and what are some of those small steps, what are some of those skills and those processes that you can learn and help your child before they turn 18 that are going to help them to be in charge of their health care.
All right, this might be a dumb question to ask, but how many people actually remember SMART goals?
Yeah, those are,
right.
They're still a thing.
Yeah. So use SMART goals as a way to help with healthcare transition and everything.
Yeah. So what do you want to learn? Then break it down into those specific, manageable time steps.
It's obtainable time.
Cool.
I'm pretty certain VA is attainable. I haven't checked
Oh,
Smart
I
in a
think you're
while.
right. No, I think you're right.
Yeah.
So we
We
also
forgot the
have,
R. We forgot the R in Smart.
well, you can figure that out while we move on.
I'll figure it out by the time this is all over.
Probably.
If I even
so
remember.
if you are looking for, what are some of the things that we need to know is there are assessments, because we know that our friends in education love assessments. And so there is actually transition readiness assessments that you can sit down with patients, you could sit down with students and go through and figure out what are the skills that they need to learn.
Very useful for IEP teams.
Yes, and there is one that's actually been developed specifically for students
Oh.
by our friends at Got Transition.
They
And
actually finally got the ball rolling on that one.
So we're doing a lot of work at integrating healthcare into special education now.
Yeah,
is
because
they're
last
helping
time
us
this
do a
didn't
lot of work.
exist.
Right.
Well,
So
last
now
time
it's
we
there.
did this whole thing of talking about healthcare transition, this specific assessment from Got Transition didn't exist.
Yep. And we'll send all the slides out to you so that you'll be able to look at this transition too. The other thing that I just wanted to, we're gonna
Venn diagram.
we're gonna zip through these. Is remember that we understand that health happens in the midst of all other transitions that are going on in life, and it's a lot, and it can be overwhelming. But we also
Life overwhelming? Never heard of it.
honestly, it can be. But from my point of view, I also think that health is one of those foundational things to succeeding in life, in where I want to live, in who makes my decisions, in my doing well at school or at work. And so we do want to encourage that
That's a blank
that
statement.
health and the IEP can go together, is that health can be part of the post-secondary transition plan. Healthcare
high
goals.
school in there instead of IEP.
It's okay.
Okay.
Healthcare goals can be part of that. They can also be part of, some of our students have individualized health plans. And so if there's something important enough that is an individualized health plan or an emergency care plan, chances are those things aren't going to stop when the student graduates. So who needs to know that information once they're out of high school, if it's so important that we have these special plans in high school? So we need to think about how are we doing after, right, how elementary school into high school.
And high school into college.
Speaking of which, post-secondary school.
Yeah.
What happened when you were at, so you went to MATC. What sort of things were available to you to take care of yourself at MATC?
Separate testing was one of the things we discussed.
So accommodations.
Didn't really go through with it, but note taking we did end up talking about and actually executing for one of the classes. Sadly, it wasn't really poor execution, but it wasn't fully executed. It was kind of in the middle ground where I could talk to my note taker, but I couldn't get the notes they were taking for the class.
The technology didn't
did not work out the way it should.
With the health system that was there, do you remember what your options were for your mental health and for your physical health?
For mental, it was a general therapy group and everything, or at least a in-school therapist. Counselor. There we go. That was the word I was thinking of. And then for MAT specifically, they have for physical health, gym, which I ironically enough did not need to use their gym room, as all my classes were at least a few stairs up from each other, or at least halfway across the hallway. So carrying a very heavy backpack was my exercise.
Way to exercise. Good job, dude.
Yep.
So each school you're going to want to find out what do they offer in the area of mental health and physical health supports, and you'll usually find that out through your disability resource centers. The other
college has one.
All colleges should.
The
other area that we like to think about is employment and health. Did you when you got your job, did you talk to your supervisors about any of your disabilities or healthcare needs?
They do know about my anxiety and that I am on the spectrum and that I do have depression.
Okay, so you have talked to them about that.
I have talked to them about it, and they're just simply like, okay, if you need help, just ask.
Cool. And that's one of the major things that you have learned too, is how to
Yep.
ask for help.
Always ask for help, no matter if you are a neurotypical or not. Asking for help is key, especially when it comes to all forms of help.
And the other thing that we encourage is to understand what happens, when do you need to call in sick? There's a slight difference between not feeling well and not going to school and not feeling well and not going to work. They're different. They seem like they should be the same, but they're not. And so learning, when am I too sick to go to work? What do I do if I'm too sick to go to work? Who do I call? You're responsible for taking care of that as an adult. So that's just a little bit on employment. Housing and life includes the whole idea of transportation. How are you going to get to and from medical appointments, picking up your prescription, learning what your body needs, eating healthy, learning that a clean body is a healthier body. Going back to that whole, I don't know why kids don't like to take showers. It's really weird to me, but it happens. And so trying to encourage
I feel like that was an attack on me.
It was.
I hate
Okay.
it when I'm right. Oh, speaking of rights.
And rights and health and rights and decision making. So we just want to remind people that you can go back and listen to the different options that are available to help young adults with disabilities to make decisions. That limited or full guardianship is not always the best option. It's an option that's out there, but we could begin with lesser restrictive options like release forms, supported decision-making agreements. So go back and listen about that. So why is health important? Hunter, why does it matter?
Increase independence, success in day-to-day life, post-secondary education success, either by getting your degree or going, yeah, let's just back away from college for a while, and then working and then figuring out what you want to do in life, healthily speaking, of course, and where you want to live and how you're going to get everywhere.
Excellent. And so we have Health Transition Wisconsin has all these tools on our website. So feel free to check them out. We talked about the tools of adult providers, decision-making, health insurance, emergency contacts, appointments, medications, health summary, and about me. One of the things that I do want to just make sure you understand is that we are all about health.
Lisa, I was wondering where you put these guys.
Health, we want people to be their own self-advocates. We want them to grow up being in charge of their healthcare as much as they can and advocating for their health.
Very key.
And so whatever area you are involved in, think about how health can go into your life. There's other slides that include some resources, and we'll send those out to you. But I want to go ahead and introduce you to Dr. Leah Ederer. And so I will be able to share my screen. Leah, if you wanted to go ahead.
Hi, thank you. I was having some technical difficulties earlier. I had you on my phone and my one computer camera wasn't working. So finally have gotten through this time. So I actually really appreciated your talk and kind of hearing about transitions from your point of view, because you're so right. It isn't just like the physician and the patient. It really is things that are happening. I loved your suggestion. I actually wrote it down about filling the prescription bottles and the magical bottle that just keeps filling itself. That is, that's a real thing. Kind of like the coffee table in my house just continually gets cleaned off. So I also liked the middle school. Well, you said high school, but my kids are in middle school now, like even including that and health. And here in Sauk, we are doing a lot of doing specifically mental health, but all health in starting in our schools as well. But I wanted to kind of tell you what I do in my steps of transition. And these are things that, right, you as parents, you as educators can help with. And I'm just going to do kind of the timeline that I do for all of my patients. And then The About Me form is up here, and that is one thing I do kind of special for my patients with special needs. So with all of my patients, the age of 12 is my magic number. At the age of 12, I ask parents to step out of the room. So I say, right, I'm going to start out, I'm going to ask you easy questions. And I talk about what their favorite food is. And I talk about who lives at home and what their favorite subject is. And then I say, I'm going to start out with easy questions and I'm going to ask you hard questions. And at the end of the visits, I'm going to have your parents step out of the room and I'm going to ask you my hard questions again, and you can give me a different answer. So if they want to, my hard questions are you smoking? Are you drinking? Are you doing drugs? Are you having sex? Any concerns about your body image or the way other people see you? Any thoughts of hurting yourself or being better off dead? And any questions about your period or puberty, depending on what my audience is. And I go through them, and oftentimes it's a no for all the questions. If they want to admit that they are having sex with their parent in the room, that's great. Opens up a lot of discussion. We can talk about birth control or STD testing, whatever kind of comes up that way. But if not, I have them step out of the room, and then I ask them those questions again. They know what to expect. They have time to mentally prepare about what they are going to say. And if there's anything other than no, if it's like not really, right, that gets dug into as well. And I will say that I do give all of my teens an out. So I say, if you want to, there are certain things that you can make decisions about that you don't need your parents' permission. If you want to talk to me about something and you don't want your parents to know, tell them you want to talk about acne. That is my cue to ask your parents to step out of the room and we can talk about anything you want. Because oftentimes it's hard for a child, a teen, to get into the office, right? They don't have transportation. They don't know how to make the appointment. They don't know how to get here. So acne, I feel, is a pretty safe way to get kids into my office. So that starts at 12, and then I have my kind of rock and roll talk before people go away to college or military or leave the house. And by that point, usually parents aren't in the room anymore, but I figure that kids aren't always telling me the truth anyway. So I say, well, even if you're not doing these things now, you're going to be exposed to them, and you're probably going to try them when you are in college. So, or whatever the next step of life is. So at least do it with people that you trust. I don't want you to wake up hungover and pregnant. I don't want you to, right, be, drunk and get HIV or kind of anything along those lines. Oftentimes, if I have time as well, I will do a kind of a dry run. Like, all right, so if you're in college and you break your ankle, what are you going to do? So we can, or you have a mental health problem or something like that. And whatever I think their most likely problem is, we will talk through it, whether they go to the health center on campus, and if they, do you know where that is? Make sure you look it up as soon as you get there. Or, right, if you have a broken ankle, you need to go to the emergency room, and do you have your health card? Do you know where it is? Make sure you get a copy of that. For people, right, when they leave the house and they don't have it anymore. Because, right, I don't think that I had it when I went to college. It's not something that people think about, right? It's just not. So that is my kind of transitions in general, but I did want to talk about this about me form. So I am involved in Special Olympics. I am their health advisor for the Healthy Athletes program. And this is something that I learned about through them. And I think as a physician, it's super helpful for me. And I really like the ways that it talks about how to better understand. And oftentimes I know the family that I'm going into, but if I don't, this is really helpful to be right. I really like pictures, and this is anybody. I will do a lot of pictures. I Google, right? You know, this is what carpal tunnel looks like, or I'll Google what a hamstring tear looks like, and I show people kind of pictures. I will show people, you know, what a heart looks like. I have models of what cholesterol looks like. Right. We're all still learning. We're all human. I tend to use a lot of analogies, which is not always the best for people with autism, because they're very kind of concrete thinking, and I sometimes lose people that way, and that's something that I need to work on. But it is helpful to know, right? Talk to me, talk to my caregiver too. Right? I need an interpreter. It'll get you to slow down and use kind of that fourth grade language. And right, we're all busy, and sometimes we don't have time for that teach back, right? So I tell you, and then I ask you what that means to you, and having this just gives me that moment that I need to slow down for that. It also helps because in the form, it asks, you know, why are you here? And it will give an opportunity to kind of formulate ideas. I like it when people come in with lists. I don't like it when they have like 18 things on their list, but you know, it helps me to kind of go through like, all right, did we get everything on your list? You know, or maybe, you know, we can do these top 3 or 4 things, and we'll have to come back for the rest. But right, I want you to feel satisfied when you leave the appointment. I don't want you to go and email me 5 minutes later because, oh, I forgot this or that. It creates a whole bunch of more steps that you don't need. There was a chat in the box about when do patients get this. So ideally they would have it with them and bring that in, but typically if they're new to me, my nurse, when she rooms them, will then recognize it and give the form to fill out as well. And then by the time I get around, because I'm not always on time, they will have a chance to fill it out. Do you guys have any questions for me? I'm happy to kind of talk about other things that have, you know, that I do, but I wanted to make sure that I kind of gave you some timelines and things to think about, and then kind of specific for this population.
So then, Leah, is this a form like a pre-visit form that they can fill out before they come see you? Is it available electronically? Is it in the office that they hand it out, or how do they get a hold of this form to then share it with you?
So I try to give this out at any type of transitions talk that I'm at. I try to have some with me. I feel like I'm personally trying to promote this. I do have them in my office that they can fill out once they get here. But then I I shared this with Tim and Liz before, so there's an electronic copy that you guys can print out and take, share with your doctor. And it's supported by the CDC, right? It's not, I work at Prairie Clinic, it's not Prairie Clinic specific, but the concepts are there that you really could use anywhere.
Yeah, and we'll include that link on the resource sheet.
Perfect.
Absolutely. So yeah, any questions, please put them in the chat or feel free to unmute yourself. Okay, well, Leah, I really appreciate you hopping on tonight. Like big time. We normally, trust me, I've been doing this for 3 years and I've never had a doctor join us yet. So thank you so very much for bringing that perspective. It's really important.
Awesome. Well, thank you. And I am constantly learning from all of my patients and all of my families. So I would say, right, don't be afraid to, approach your doctor and tell them what you need and what, and how they can help as well, right? We all went into this field because we want to be able to help people.
Right.
So, yeah, don't be afraid to speak up. So.
Fantastic. Thank you. Thank you again. I really
Thank you.
appreciate it. Liz, would you like to talk a little bit about connecting this to Sauk Prairie Schools?
Yeah, that would be great. Thanks. So next slide, thank you. So I wanted to talk a little bit about, as a transition coordinator, what I can try and do to help with the process of bridging the gap between adolescence and adulthood. I do assist the families in the referring process to the ADRC at 17.6. I can help you coordinate with any outside agencies with whom you may be collaborating. I have I can share healthcare toolkits. I have a medical record and a medication folder that I can share with you. I also have parent portfolios available in Spanish and English that I can give to families as a way to kind of keep track of IEPs, goals, any paperwork that you have that goes along with the special needs that your young adult has. I also have copies of the Wisconsin Transition Resource Guides, also available in Spanish and English. I can help connect you with local independent living centers that might be able to help you navigate some of these transitions. I can connect you with the school social workers who can assist in connecting you with the applications for medical coverage. And I can help you plan through the post-secondary transition plan. That's the PTP, and we had a training on that a few weeks ago, and for the steps that you need to take in the process and that your young adult needs to take in the process. So we do have some couple more Transition Talk Tuesdays coming up. Next week, we will have Working While on Social Security, Ticket to Work, the PASS program, and benefits analysis. All really important things for you to keep in mind as your young adult is going to work, and how not to compromise their benefits through Social Security. And then our last Transition Talk Tuesday is on October 24th, and that is the Sauk Prairie Beyond 18 Programs and Employment. I'm going to have a couple of our instructors present, and then we will also have a guest speaker from the Ho-Chunk Nation who will be talking about the steps necessary for transition of tribal members as they are aging out of the system in the school district. Next slide. So here is the last another link for you to use if you want to sign up for the last two Transition Talk Tuesdays. Also, keep in mind that everything has been recorded and is on the website at that link. Tim was saying that we are having a little bit of difficulty with the Spanish translation for last week's, but we're working on getting the glitch out, and that should be up in Spanish. Again, it's been great having the Spanish interpretation. We've had so many families accessing the Spanish translation, and we're really excited about that we're able to reach our families who speak Spanish as well. And if you have any questions, please feel free to reach out to me. And thanks again to Tim and his son Hunter and our Spanish interpreters and our doctor present to help us navigate some of the steps that we need to take moving into adulthood.
And do want to leave, I know that we're running a little bit over, but any questions or discussion? We thank you so much for being here and joining us. We understand that it's hard to take time out, but thank you so much for being here, and feel free to return to the recordings as often as you like. We'll have them available as soon as we can. But any questions or comments or anything before we sign off tonight? Okay.
Thanks, everybody.
Thank you so much for being here. We're going to stop the recording. So if people want to hang on, we can then say goodbye that way as well. So just one moment.